This video is to demonstrate procedural sedation. So we'll start out as a provider and we'll go into the patient's chart, into quick orders to place an order for the procedural sedation power plan. This can be found under the critical care folder. So as always, we'll modify our power plan so that we can see the contents inside. So we'll go ahead and we'll choose the orders that we want. We'll choose ketamine and propofol, and you can see the pre-built order sentences are to have 200 milligrams of each drawn up at the bedside for procedural sedation and hold the first dose until directed. And we can go ahead and say done. So now that we've placed those orders, we'll switch to the nurse and we'll go ahead and review them. So we can see on launch point that there is some outstanding orders for us to review. So we can see the ketamine and propofol here. And then there's also a respiratory therapy consult and then nitrous oxide gas administration, PRN for pain. So we'll go ahead and we'll review all of our orders. So we can navigate to the medication administration wizard either through the toolbar or from the activities view. So what we would do here is we would obtain the medications from our OmniCell, and then we would scan the patient's wristband, which would bring us to this screen, and then we would scan each of the vials. Because we don't know until after the procedure the total amount of each medication that we'll use, what we'll do is we'll go ahead and sign for these medications for the whole 200 milligrams of each, and what we'll have to do is go back and reconcile afterwards. So we'll sign for each of those medications. We'll go into our patient's chart to begin some of our preliminary documentation. So in iView, what we'll do is we'll go to Adult Interventions, and we'll go to Specialty Gas Management. This is an area where we can document the administration of nitrous oxide. We can say that we did the initial setup. And then when we're ready, we can document the discontinuation. Next, we'll go down to our procedural sedation band. And in pre-sedation monitoring, we can do some baseline vital signs and document the last oral intake. So we'll say that that was yesterday, last night. We can document our pre-procedure timeout. Consent forms can be printed from FormFast, and they still need to be signed by a patient, so they'll need to be printed out and then they'll be scanned back into the chart upon discharge. For procedural sedation medications, we make dynamic groups. We'll have to do them one by one. So we'll go ahead and create those so that when we're ready to administer, those are there for us. Now we're ready to start our procedure. So anything with blue text means that it's a hyperlink to some reference text. So you can see here that the procedural sedation / analgesia start time is the time the first sedation agent medication is administered to the patient. So we can go ahead and say that that is now. And we'll go ahead and we will document the medications that we give. We'll say that it didn't have very strong effect, so we're going to repeat. And we can go ahead now and say that we're starting our procedure right now. So generally the sedation scale used is modified Aldrete. And a score is calculated for us automatically. We can see here that this is reference text, and we can access the scoring grid that most nurses are used to looking at during their procedural sedation. So at any time they can look through here for their reference. If this patient had a bedside monitor that was associated to the device that we're using to do our documentation, all we would have to do is double click in the time here, and any vital signs that were captured on this associated device would automatically pull in here for us. And all we would need to do is just verify that the values were correct, and we could go ahead and sign. So for now, we'll just put in another set of vital signs here. We'll go ahead and we'll say that we're going to stop the procedure now. The sedation stop time is the time that the patient has returned to the appropriate sedation degree. So that hasn't happened just yet. And you can see that the sedation total time gets populated there for us. So again, if we double clicked, then our vital signs would populate in here for us. And you can see that the score is populated as well. And for discharge criteria, there has to be a score of 10 for a total score of at least 13 out of 16 for discharge criteria for the patient to be discharged from one-to-one monitoring. And we'll say the patient went home with a responsible adult, and We'll document the discontinuation of the gas. And then we want to go ahead and reconcile the medications that we gave. So you can see here that 200 milligrams is what we signed for. So we're going to go ahead and modify. And we gave 30 milligrams of ketamine. So we'll go ahead and sign there. And we gave 60 milligrams of propofol. So now the correct doses that the patient were given is accurately reflected on the MAR. So now we're back to the provider role. We'll go into the patient's chart. And down to physical exam. We'll go into procedures and make a note here. Document our discharge diagnosis. And then we'll just put in some new orders. This icon lets us know that we have a mandatory field that we haven't completed. And then we can go ahead and place a discharge order. So now we're logged back in as the nurse. As you can see, a discharge order has been placed for the patient, and there's a few orders for us to review here. If you wanted to review the process for departing the patient off of LaunchPoint, you can refer to that workflow in the video ED to Discharge, but that will conclude the demonstration for procedural sedation.